So, this e-lecture is on cardiomyopathy, and in cardiomyopathy, 70% of patients die within 5 years of symptom development. Myopathy is a muscular disease in which the muscle fibers do not function. The main problem is in the muscle. So, here the main problem is in the cardiac muscle. Types of cardiomyopathy. There are three types of cardiomyopathy. Restrictive, which is where the ventricles are stiff and they cannot fill properly. Then hypertrophic, where walls of the ventricles they thicken and they become stiff. And in dilated cardiomyopathy, ventricles enlarge and are not ventricle enlarge and are not able to pump enough blood for the body's needs. Um, Causes of restrictive cardiomyopathy: anything that will change the composition of the heart muscle, making it stiff and non compliant. Example: multiple myeloma and amyloidosis. Now, multiple myeloma, you all know, is a bone cancer. Amyloidosis is a condition where glycoproteins get deposited within your heart muscle, and accumulation of these glycoproteins in the heart changes the heart function. The heart becomes stiff and rigid, resulting in a decreased volume in the ventricles. And as you know, low volume in the ventricles, there'll be decrease in cardiac output. So, signs and symptoms of congestive heart failure are present in this kind of cardiomyopathy. Restrictive cardiomyopathy, the common signs and symptoms which you can see are that of heart failure. So you will see a low heart rate, like you can see a bradycardia rhythm, you can see neck vein distension, peripheral edema, liver congestion, also abdominal ascites. And why do you see all this? Because with time, because of the myopathy, the heart is becoming stiff and rigid, and the ventricles do not relax properly during diastole, and this results in a decreased volume in the ventricles and ultimately a decrease in cardiac output. And the patient will show signs and symptoms of CHF due to decrease in forward flow of blood. So there is a decrease in forward flow of blood. Late signs of restrictive cardiomyopathy will be nocturnal sharpness of breath, abnormal heart sound S3, pink frothy sputum, cough, crackles, orthopnea, tachycardia, and restlessness. Now, tests. There are some tests and treatments for restrictive cardiomyopathy. Diagnostic test will be EKG, echo, MRI, cardiac, cath, and biopsy. EKG will, it will detect the abnormalities in heart's, conduction system. Echo will show if there is any large atrial muscles. So if there is enlarged atria, then echo will show it. MRI will show any abnormal texture of in the heart muscle. Cardiac cath will measure the pressure in heart chambers, and biopsy will identify if there is any infiltrating substance. Um, Now, with restrictive cardiomyopathy, medications are not helpful. Heart transplant can be one option, and they also use something called therapeutic phlebotomy to reduce the iron load. The term iron load um, is the term iron load overload cardiomyopathy is to describe a secondary form of cardiomyopathy which results from too much iron in the heart muscle, and it can happen because of genetically determined some disorders of iron metabolism or multiple transfusions. So there is too much iron in the heart muscle. And phlebotomy, what is mean is like we take out the blood from the body, so the iron is, so the heart muscle does not get overload of iron in the body. So this will also help as a treatment method for restrictive cardiomyopathy. So we all know that iron is very important for our body, but in this case, too much iron is destroying heart function. So that's why what they do is they pull out the blood. So they can pull out some iron because it's excess in the heart muscle and it's destroying the heart function. Important things to monitor in the patient who is suffering from restrictive cardiomyopathy will be infection, malnutrition, fall, injury, and depression. Depression, you all know, is because um, patient will have problem coping with the disease. Fall there because they'll be weak, dizzy. Malnutrition because they have so much shortness of breath, they are struggling to keep pace in their life, with periods of activities and rest. Their appetite reduces, and there is always chance of infection because their immune system goes down with these kind of diseases. Um, Something which I want you to research on is, suppose if you are taking care of this patient, what nursing action you can do to increase the oxygenation in this patient, and what end of life care nurse can provide to this patient. Research from your ebook, or you can find any other book or resource to give me the answer for this. Okay, let's go to another kind of cardiomyopathy, which is hypertrophy cardiomyopathy. And the common causes of, I think I forgot to write causes here. The common causes of hypertrophy cardiomyopathy is uncontrolled hypertension, inherited gene, and acromegaly. Now, uncontrolled hypertension, what it does to the body, it causes the ventricles and septum muscles to become hypertrophic. This causes the actual chambers of the heart to become very small, and little volume ejects out of the heart, thereby decreasing cardiac output. Now, less forward flow leads to backward flow. So, this is what happens in uncontrolled hypertension. So, in uncontrolled hypertension, it causes the ventricles and septum muscles to become hypertrophic, and this causes the chambers of the heart to become very small, and little volume is ejected out of the heart, thereby decreasing the cardiac output. And here, instead of the blood flow going forward, it's going backward. Second is inherited gene. The inherited gene, it affects the cells of the myocardium, so that there is hypertrophy again, and the asymmetry of the left ventricle. So the left ventricle will become asymmetrical, and it will hypertrophy because of the inherited gene. Acromegaly, it's excessive growth of the heart muscle due to overproduction of growth hormones. So when there is overproduction of growth hormones, the heart muscle also has overgrowth. Now, hypertrophic cardiomyopathy signs and symptoms. There'll be fatigue, weakness, and some um, late signs of left-sided heart failure. So why you will have fatigue, weakness, and late signs of uh, left side heart failure? Because the left ventricle will become stiff. It will become like a large stiff muscle mass. This will leave very little room to fill the left ventricle with volume. And when there is low volume in left ventricle, low cardiac output drops. Less ventricular filling and less forward flow results in fluid going backing up into the lungs. And as cardiac output drops, oxygen delivery is decreased. That's why there is fatigue, weakness, and late signs of left side heart failure. Why there is fatigue, weakness, and left signs of heart failure? Because the left ventricle becomes a large, stiff muscle mass. This leaves very little room to fill the left ventricle with volume. As a result, cardiac output drops. Less ventricular filling and less forward flow results in fluid backing up into the lungs. As cardiac output drops, oxygen delivery is decreased. So that's why there is fatigue, weakness, and late signs of left side heart failure. Now, why patient has arrhythmias and chest pain? Because um, if patient has inherited um, hypertrophic cardiomyopathy, then patient can show some arrhythmias. As the heart hypertrophies, there is increased oxygen demand in the body, and when the demand exceeds the supply, myocardial ischemia happens, uh, leading to arrhythmias. And then there is something called uh, palpitations. There will be palpitations because second the size of the heart, which is becoming big, can lead to some arrhythmias and palpitation, some arrhythmias, and sometimes the patient will feel arrhythmias as palpitations. There can also be sudden cardiac death, and the sudden cardiac death will be most probably um, due to the fatal arrhythmias in this patient. Now, um, what kind of test and treatments we can have? We can have we can do tests like EKG, echo, cardiac cath, thallium scan, chest X-ray. Chest X-ray will show any increase, any mild or moderate increase in the heart size. Thallium scan, it will thallium scan will show any myocardial perfusion defects. So if the heart is not perfusing properly, heart muscle, it will show that. A thallium stress test is actually a nuclear imaging test that shows how well the blood flows into the heart during exercise and at rest. Radioisotope material is given to the patient intravenously. It settles into the heart muscle and can show spots that are abnormal. So that is what happens in thallium scan. Echo will show left ventricular hypertrophy and thick intraventricular septum. Cardiac cath will measure the pressure in the heart chambers, um, and then EKG will show left ventricular hypertrophy, ventricular and atrial arrhythmias. So echo and EKG both will show left ventricular hypertrophy. Um, now, um, patient can also have some um, yes treatment. It can the best will be always heart transplant. We replace the heart because there is problem with the heart muscle, but they can also go for some medications like beta adrenergic blockers, calcium channel blockers, anticoagulants, antiarrhythmic drugs, cardioversion, um, implanted cardioverter defibrillators, and ventricular myectomy. Now, adrenergic blockers, they slow the heart rate, and they reduce the heart's oxygen demands, increases the ventricular filling by relaxing the obstructing muscle. So that's what the beta adrenergic blockers will do. Calcium channel blockers, they will increase the ventricular filling by relaxing the obstructing muscle. Antiarrhythmic drugs, they will reduce arrhythmias. Cardioversion will treat atrial fibrillation. Anticoagulants will reduce risk of systemic embolism with atrial fibrillation. And implanted cardioverter defibrillator, which is commonly known as ICD, will treat any ventricular arrhythmias. And ventricular myotomy or myectomy, this is surgical resection of hypertrophied septum, which eases the outflow obstruction and relieves symptoms. So, in septal myectomy is a surgical procedure where actually the heart septum is reduced by surgery. Okay, next go to the next slide. Important points to monitor in hypertrophy cardiomyopathy is that patient uh, that what can harm my patient, and the things which can harm this patient is not taking antibiotics prior to dental or surgical procedures reduce risk of infective carditis. So I think I should have changed the heading on the slide. Important to monitor. It should be important to monitor in hypertrophic cardiopathy. These are the things, if they are not monitored, can lead to problems, so can harm the patient. So if the patient doesn't didn't take antibiotics prior to going to dental or surgical procedures, then he might increases his risk of infective endocarditis. Patients should be monitored for any lung edema, pulmonary edema, and any also lethal arrhythmias like ventricular VT and VFib, okay, ventricular tachycardia and ventricular fibrillation. Um, there is third kind of cardiomyopathy. It is dilated cardiomyopathy. The causes are chemotherapy, alcohol and drugs, CAD, coronary artery disease, valvular heart disease, viral bacterial infections, and hypertension. Now, chemotherapy presents some toxic effects, and these toxic effects of the drugs has some effect on the myocardial cells, which will dilate the ventricles and they cannot contract properly. Cardiac output will decrease in this, and signs and symptoms of heart failure are observed. Now, alcohol and drugs, toxic effects of both alcohol and drugs will be very direct. There will be direct toxic effects of alcohol on the heart cells. CAD, CAD will be coronary artery disease will be decreased oxygen delivery to the heart muscle, and this will lead to pump failure. The heart muscle dies and is replaced by scar tissue. The uninjured heart muscle stretches and it thickens to compensate for the lost pumping action. Valvular heart disease will increase the volume or increase resistance to it will increase the volume or increase resistance to outflow in the chamber of the heart over time, and it will distend the chambers and the muscle will become stretched, thin, and weak. Both viral bacterial infections. Um, this will lead to inflammation of the heart muscle. Heart muscle becomes weak, it stretches to compensate, and this will result in heart failure. How with hypertension, cardiomyopathy will happen due to hypertension, ventricles and septum muscle will hypertrophy. That will cause the actual chambers of the heart to become very small and little volume will eject out of the heart, thereby decreasing cardiac output. Signs and symptoms of dilated cardiomyopathy: shortness of breath, orthopnea, dyspnea on exertion, paroxysmal nocturnal dyspnea, fatigue, generalized weakness, and dry cough at night. All this happen. Why? Because there can be left-sided heart failure and ineffective ventricular contractility might be happening, It might be happening reduced pumping ability, or there is reduced cardiac output to the body, and then blood is backing up into the left atrium and lungs. So that's how some of the shortness of breath and orthopnea, dyspnea can happen. Why there is peripheral edema, hypotomegaly, jugular vein distension, and weight gain? Because it will show the sign of right-sided heart failure. There will be ineffective right ventricular contractility. There will be reduced pumping ability, and there will be decreased cardiac output to lungs. So that's how peripheral edema and then hepatomegaly, jugular vein distension, and weight gain will affect uh, the functioning of the heart. Now, peripheral cyanosis tachycardia will be due to low cardiac output. Murmur will be due to leaking heart valves. Arrhythmias will be due to stretching out of heart muscle, leading to arrhythmias. And chest pain and palpitations will be um, uh, why a patient will feel chest pain and palpitations, because arrhythmias can be felt as palpitations. Syncope will be there due to decreased cardiac output. Again, the same test we discussed earlier. Angiography will rule out any ischemic diseases. Chest X-ray will show moderate to marked cardiomegaly or pulmonary edema. Echocardiography can also show ventricular thrombi or degree of ventricular dilation and dysfunction. There is something called gallium scan. Scan also identifies patients with dilated cardiomyopathy or any kind of inflammation in heart muscle. Um, Cardiac catheterization, it will show the left ventricular dilation and dysfunction, ventricular filling pressures, and diminished cardiac output. Um, with endomyocardial biopsy. Endomyocardial biopsy will determine what is the underlying disorder happening, and then electrocardiography ECG will rule out any ischemic heart disease. Treatment for dilated cardiomyopathy is um, CABG, which is coronary artery bypass surgery, which manages the dilated cardiomyopathy from ischemia. So, dilated cardiomyopathy state should be the patient suffering from dilated cardiomyopathy um, disease should be uh, his disease should be managed so there is no ischemic arteries. So, coronary artery bypass graft will manage dilated cardiomyopathy from ischemia. Um, there will be pacemaker to correct any arrhythmias. There will be anti-arrhythmic medicines to control arrhythmias, beta adrenergic blockers to treat heart failure, and then there will be diuretics to reduce any fluid retention. There will be ACE inhibitors to reduce afterload through vasodilation, and the patient can also be given oxygen therapy. In some cases, valvular replacement or repair will be done, and this will manage the dilated cardiomyopathy from valvular dysfunction. Heart transplant can replace the damaged heart too. And then the most important teaching moment for nurses will be lifestyle modifications, which is smoking cessation, low fat, low sodium diet, physical activity encouraged, abstinence from alcohol or drugs, and then reducing symptoms and improving quality of life. Things which can harm your patient and you need to monitor are any pulmonary edema, any lethal arrhythmias, any malnutrition, or any infection. Um, you will be expected to read the client care of a pacemaker, and I'm posting a handout from a very great hospital in East John Hopkins. So make sure you go through that handout and kind of know that handout very well. Okay, so this brings to the end of this presentation, and the next lecture coming on will be on infective cardiac diseases. Okay, thank you.